Brianna with Nurse Deck. As you know, we are an online community built by nurses for nurses, and just very committed to giving a voice to every nurse out there and connecting them with the resources and guidance and humor that they need today and always. Today I am speaking with Leanne Meier. Leanne has 40 years experience as an RN in a variety of fields: ICU, hospice, med-Surg, obstetrics, education. Leanne also has 17 years of management experience teaching conflict resolution. You've also done your share of personal coaching with your own business, with an RN refresher course. RN refresher course for 5 years, and currently has a podcast, Once a Nurse, Always a Nurse, that has a huge following. It's in 70 different countries. I stayed up way too late listening to an episode on mental health and the pandemic that was very timely. And Leanne also does a bunch of public speaking, and is dedicated to being a hub of information and education for nurses today and in the future. So I'm so excited to talk to you today, Leanne. And we've got our standard questions we're going to run through, and then we'll see where the morning takes us. So welcome.
Sounds great to me. It's very interesting to be on the other side of the...
I bet. Yeah, it's like when the nurse becomes the patient, and here it's the interviewer and the interviewee. So yeah, I can imagine. I'm brand new to this whole thing, so I'm going to ask you for your pointers later on. But tell us how you got your start in nursing. Let's begin there.
Well, my start in nursing is very similar to my start in doing the podcast. I actually backed into nursing.
Okay.
So I graduated from high school in 1973, right in the midst of the Vietnam War. And I had 2 older brothers that went off to college and became conscientious objectors and hippies, and was tremendously challenging for my parents, to say the least. Didn't understand what was happening. My father was very proud of his military service, and so it was very difficult. And I was pretty naive and pretty much believed that college had somehow done this to my brothers. And I was fearful of going and, being in that kind of environment. And so I was looking for something that was safer. And 2 of my friends had gone to nursing school the previous year to a diploma program in Duluth, Minnesota. And so I went to visit them, and it was almost a cloistered dorm. And that just felt very safe and comfortable to me. And so I went there, but not thinking I would really make it as a nurse. So I bought the cheapest of everything. Scissors, stethoscope, shoes, whatever it was we had to buy. I bought the cheapest because I figured I'm never going to stay here.
Right. Yeah.
So I ended up loving it. Big surprise. Continued on. I went out to Denver and did some work there for a couple of years. Loved that also. Came back to Wisconsin and worked there for 4 years, and then into Minnesota, and stayed there until I was injured and could no longer work as a nurse.
Okay. And is that where you're located now? Are you still in Minnesota?
I am in Minnesota. Okay. And so mainly my 94-year-old mother has informed me I'm not allowed to leave until she dies.
Okay. Well, those are strict orders.
Yeah, those are pretty strict orders.
Yeah. Great. We're going to switch gears a little bit and just jump right in to an issue that many nurses are dealing with right now. Where do you see nurses struggling the most during the COVID-19 pandemic?
Yeah, I think that mental health is, of course, the most obvious one. Any of us who are nurses and are paying attention at all are realizing the incredible struggle that nurses have. I think that underlying all of that is years and years and years of abuse and neglect and disrespect and lack of support and just all of the things that go along with that. And in fact, somebody told me one time that they felt that nurses lost their voice when they went into the hospital. And
Yeah.
you think about it, nurses were pretty much in the community, prior to hospitals hiring and utilizing them. And at that point, they were able to do far more in the community. Just all of the, historic nurses that were able to really show us what nurses' perception of healthcare and medical perception of healthcare is quite a completely different ballgame. And I think that the frustration, the anger, the depression, the suicidal actions that many nurses are taking come directly out of this concept of and now I just lost that word that you were listening to last night, the moral, what did they call it? Moral suffering.
Yes.
Yeah, moral suffering that they're experiencing, because it goes, what they're doing, what they're being asked to do, and what they're doing goes directly against their moral code of caring for patients and wanting to be able to do good care for every patient that they have. And yet they're being set up in situations, asked to do the best, but not given the supplies, how to handle their situation, clarity, and supervision even. And many of the nurses that become managers are excellent nurses that just get put into the role. I was one of them. Got $1 extra an hour, and I was, voila, you're a manager.
Yeah. Right.
And no extra training whatsoever.
Yeah.
So I think all of that has just accumulated and has run smack up against COVID. And we began to realize that all the things we suspected are really true, that the administration does not know what we're doing. They are far more, and I shouldn't say all administrations, but an amazingly large number of organizations that have become so big, business-minded. Everything is about trying to squeeze out the very last possible dollar, not very much about health.
Right.
Disease care is really what we are doing now.
Right. Very reactive instead of proactive.
Right.
Yeah.
So needless to say, nurses are in a very dangerous and hellish place. Yeah.
Yeah, I couldn't agree more. Especially you feel that when you work in a big corporate hospital environment as a bedside nurse, especially when you're just starting out and trying to get your footing. I remember telling my patients specifically when our census would go crazy and they'd be waiting for a bed down in the ER, like, you will encounter lots of lovely people. We all work in this giant factory, but each person you encounter really does care about you, even though at times you are going to feel like a cog in a wheel, So, but I totally understand that sense of the moral suffering that you say. And I couldn't agree more that COVID was just the scalpel that excised it for all the world to see, now it's just oozing all over the place.
I've kind of come to think of it, and I had been for quite a long time, as a house of cards, that healthcare had turned into a house of cards.
That's a great analogy.
Those people who understood what it was were terrified to pull any one card out because the whole thing was going to go down.
Right.
COVID pulled all the cards out.
Yes.
We're down. We're flat.
Right.
And my worry now is that people are going to have amnesia and go right back to where it was.
Yes.
So I don't think that, we were needing more nurses previously because so many of the boomers my age are leaving every day, and we're leaving every day, and now are leaving even earlier than their own retirement dates. I really fear that we will not have nurses, and it will be almost impossible to win back the trust that has been completely and utterly destroyed in so many places across the country.
That's exactly right. I couldn't agree more. I think, and in some terrifying ways hospitals and administration has realized the brink they can push nurses to the point where they're losing them, but they're just going to pull back a tiny bit from there instead of revamping it. And I hope nurses use their collective voice not to let that happen. But yeah.
That's a real challenge, because I think, and especially since we went into the hospitals, for the way that the structure is set up to attract bullies.
Mm.
We certainly have, nurses that are bullies, even well-meaning nurses that have kind of morphed into this kind of behavior and attacking each other. And I don't know that any of that was intentional, but just the structure itself has made it happen. The hierarchy and, the needing to be in the highest pecking order, and then taking it out on whoever is either, beside us or below us.
Yeah.
Just creating a dysfunctional and horrific place to work.
Yeah, that's true.
When what you want to do is create a healthy place to work. Yeah. It's very difficult if you don't have those supports around you and above you to make that happen.
Yeah. Yeah, I agree. I've seen it happen for sure. Worked in places like that myself. What are some things that nurses can do to get the mental health support that they need?
Well, I think the beginning of COVID was a complete and utter mess because, one, people were used to ignoring nurses. And so, and especially when we would speak up and say, help, we need help. They would say, oh, they don't need help. They always say they need help, or they always say they can't do it. And then they do.
Right.
And we do.
Right.
We somehow innovate, whatever it is, we make it work for the patient. And so I think that was what people were starting to do in the initial. I think they thought it was going to be, this is a short, we can do this for 4 months. It'll be great. We'll show them. And more importantly, I think that nurses felt like this is our opportunity for people to really see what we do and how we are the people most appropriate to manage patient care and patient management. However, I don't believe that happened. And somewhere around February, I think, is when the reality began to really sink in for nurses that it was going to be same old, that they still were not going to be heard. And I think that was confirmed for them when we got to Nurses Week. And so many of the organizations went back to tchotchkes. That was the perfect opportunity during that week to bring nurses in, sit them down at a table and say, what have you learned? What do we need to know from you? How do we prevent this? What could have made things better? All of that would have been just so wonderful and that appreciation.
Right. A real gift as opposed to a keychain. Yeah.
Exactly. And I saw many places where that was like the fuse that got lit and the bomb went off, and nurses reacted very, very negatively.
Right.
So I'd forgotten your original question. Oh, how can they get healthcare?
Mental health. Yeah.
Yeah. I think that has gotten actually, I'll say that, repeat that since I was rubbing my nose. That has gotten much better over time. At least people have now, and particularly nurses, have noticed that nurses need this and are trying to provide it for them in many different ways.
Yeah.
The problem is the nurses that are left at the bedside are just absolutely and totally exhausted. I think some of them may not even realize that what's happening to them is mental disease.
Yeah.
And that it isn't just that they aren't resilient enough. I think if I hear that word one more time, I'm going to scream. And I actually taught a class about resiliency at one point, but it's gone so far beyond. We need to, give space to these people. We need to, and I hate to say it, but we need to ration the care that we can give so that we have a chance of saving some of these patients that are coming in.
Right.
To expect one nurse, COVID should be 1-to-1. Anybody who's a critical care nurse or in the ER, especially very sick patients, need to be 1-to-1 and maybe even 2-to-1.
Right.
And the situation is hospitals, governments seem to think it's just fine. Oh, we have way more patients than we have nurses. So certainly no problem for nurses to take several more patients. The worst I've heard was several people from North Carolina at different times told me that they have taken as many as 10 patients. Those, of course, were not on ventilators, but still COVID patients,
yeah,
and or other med-Surg patients or whatever else because of COVID.
right,
Just absolutely
right,
abhorrent
mm-hmm.
and incredibly abusive to the nurses, but also to the patients,
Yeah,
and the patients' families. So a few things that I have come across early in the pandemic. I had already started working with a group of holistic nurses who were planning for, in honor of Florence Nightingale, that they were going to do what they called a compassion caravan, that from her birthday, May 11th, I believe it is, they were going to literally get in caravans and drive from New York to New Mexico, where their 40th conference was being held.
okay.
And along the way, they were stopping at nursing schools, at hospitals, at various places to encourage and support nurses who, even before
Wow.
COVID, were really, really struggling.
Right.
So once COVID hit, we realized that was not going to happen. We immediately turned it over to doing what we were calling listening circles and putting that out for nurses. And we were surprised that how few nurses were taking advantage of this free opportunity to just talk to nurses. And these were trained coaching nurses who were very prepared to take care of whatever, these nurses brought forward. But again, we realized that, one, they didn't have time to find out that that was even available.
Right.
We're still seeing this as a short haul. I don't need that. I can take care of myself. I don't have to go to the bathroom for an 8-hour shift or a 12-hour shift. I don't need to drink any water. All the things that we've taken pride in, we're able to be in the trenches and make things work. That works in a short period of time, maybe a few days. That does not work for almost 2 years. And that's where we're at.
Yeah.
So just a couple days ago, I heard about an organization that has been around since, kind of started in 2016, but really more focused, looking at how can they help nurses specifically. And the group is, their name is Happy, is the name of their company. And they just recently, or fairly recently, I think about a year ago, started an app called the Happy app.
Okay.
And what they're doing now is they are connecting with organizations. They're also affiliated with ANA. And what they're trying to do is find out names of nurses, like putting out offers that, sorry, I better turn this off. Putting out offers to contact those nurses. So the nurses don't even have to contact them. They're hiring nurses to call nurses to say, how are you?
Yeah.
Do you need to talk?
Yeah.
Just that simple.
Yeah.
So the first interaction is free. And after that, it's like $24 an hour. But I believe even that is being paid for either by the organization or by ANA.
Yeah.
However, finding those nurses is still up to them. And so
Yeah.
it's still a difficulty. But they're finding that their result of, people really feeling like, oh my gosh, to be able to talk to a nurse that I don't have to explain what I do in order for them to understand how hurt I am, is just a treasure beyond measure.
Yeah.
So I just met them a few days ago, and I'm very, very impressed and hopeful that they will be able to reach even more nurses.
Yeah, that's great. It reminds me of the meme that goes around, or that a lot of nurses on social media say, check on your healthcare friends. We are not okay. But it's like, to the average person looking at that, that's intimidating, because there's a lot of, like you say, hurt and trauma, and nurses are not okay. So that's a loaded conversation.
the biggest blow, again, I mean, we've known for a long time that we're invisible to the general population. I realized when I was really in the trenches as a nurse, my friends and family did not understand what I was going through. And even if I tried to explain it to them, it was just completely over their heads to even begin to understand. So with this, nurses are beginning to realize people do not see us. I've had nurses who said they were asked, fairly early in the pandemic to speak to like big news operations. And when it came right down to the news people coming into their environment, they were relegated to the side. And in the meantime, they were talking to CEOs, they were talking to doctors, they were talking to anybody but the people at the bedside. And they were asking these doctors, particularly, about patient management, which they know nothing about, or I shouldn't say nothing, but certainly not what the nurses know. And so it was a very painful kind of situation for them. I hope, because I am hearing from a few more doctors who are starting to register, even they didn't understand fully what nurses were doing. I had one doctor that was the director of a department. And what he realized was that everybody was standing behind the barriers, but the nurses were going in when the crisis would happen. And it was the nurses operating at the bedside, taking care of whatever was happening. The doctors were writing orders, behind the barrier, might stay for 15, 20 minutes. They might stay, through a code, or they would definitely stay through a code. But then they're going off and they have the opportunity to kind of relieve some of that stress, even in small ways of just walking, talking to other people, all of those things. But that nurse is pretty much at that bedside for 8 hours, 12 hours, 16 hours, whatever her shift ends up being. And then coming back and doing it again and again and again. So I've lost the original question again.
No, I think we definitely answered it, and it's a good segue. I think as you were talking about the nurses calling to check on one another, I think just speaking to nurses and raising awareness is such an important facet of mental health support right now, to know that you're not alone. And in that same vein, your podcast, Once a Nurse, Always a Nurse, that you do weekly, what made you start that? This is pre-COVID.
Yes, it was definitely pre-COVID. Actually, in 2016, that was during the time period that I was teaching RN refresher course.
Okay,
yeah. Teaching nurses that had left nursing for various periods of time, up to 30 years or more.
Wow.
And were coming back to nursing and terrified.
That's intimidating. I know, I was just like,
what am I thinking of? How can I do this? But I loved it. I absolutely loved it, that in 10 weeks time that I could help them be encouraged enough to feel like I can do this. I remember more than I thought I did. I know that I can ask for help when I need it. Some of the best nurses, one nurse comes to mind you might be able to appreciate. She graduated from nursing school, got her, I want to say NCLEX, but that's not it. At that time, it was that we were just taking the boards. And she found out she was pregnant. And she and her husband had wanted to have a large family. And so the decision was made that she would stay home. She ended up having 8 children.
Oh, bless her.
And so when the last one was in like junior high school, and they felt that she could go back to work. Well, by that time it was, 28 years.
Yeah.
And she was really wondering, what am I doing? So at any rate, she is doing so well working in a nursing home environment. Of course, I said, you have been nursing your children, your friends, your relatives, your neighbors, probably everything for the last 28 years. And so now it's just brushing up on what you remember about hospital or, nursing home nursing. So that was it. But basically the person who really talked me into it was a PhD nurse by the name of Lois Sonstegard. And she was running businesses. She had been in charge of OB at the University of Minnesota, I believe was where she was. And she had a child that was sick. And so she was taking care of him at home. And she was running this business, but she wanted to start doing training and various different things that she really felt having her RN back and go would be appropriate. So at the end of the class, she came up and whispered in my ear and she said, "You have got to get this out to more than just these few students." And I had no idea how we do that. The next day, I got a cold call from voiceamerica.com, and they wanted to know if I would like to do an international talk show for nurses weekly on the what they call radio, Voice America, but online, live. And
oh yeah, and more things.
That's right. So I hung up. There was like, no way this is real. I just was like, forget it. This is ridiculous. So they were very persistent. And a year later, I was given a different producer, and she had me on the air in about a week and a half. Wow. And that was in 2017. And I've been on since then.
Yeah.
So it became a very important part of my life, especially when COVID hit in March of 2020. I realized that I had an audience of almost 120,000 people at that point in 70 countries.
Wow.
And that I could bring the nurse's voice to the public. And I think that's what got me through it.
Yeah.
So I had to be pretty much quarantined because I also take care of my 94-year-old mother. And I realized that that was going to be important. But because I was reaching out and talking to people all over the world, it felt like mission focused. And my personality is very much about relationships and mission. And so it was the perfect opportunity for me. I did do a lot of walking the floors at night, worrying about nurses all over the world. And I had to really just find a way to let go of that. And I did that by trying to find how can we get help to nurses 24/7 at the bedside. And so that became a real big, important part of what I was doing.
Yeah.
So that was a long answer to a short question.
No, it's fascinating. I love it. I always love hearing how nurses' paths change during the course of one lifetime, one career. We have the ability to wear so many different hats, and I love hearing about all the varieties that exist, especially a cold call, one that results most. I mean, talk about just gear shift.
Interesting that you'd say that, because one of the new shows that I just did a few weeks ago was a nurse, Chris Racinos, who had been the CNO of, and now my brain just went dead, a huge hospital organization and insurance organization across the country in Los Angeles. And you probably know it too. And
the only one I'm thinking of is Kaiser. I don't know.
Kaiser Health, that's it. So Chris Racinos, who is the Cno of Kaiser Health, and I had her on the show because she was starting a new program, a podcast and website and training for nurse leaders. And so I had her on the show, and one of the things that she said absolutely blew me out of the water. She said that she had started listening to me in 2017 when I started.
No kidding.
And so for 3 years, she had been listening to me. And in 2020, in October, so a year ago now, when children had to be at home, she and her husband were both working in, I believe, in hospital type situations and away from home with huge responsibility. So her 10-year-old son was essentially home trying to deal with homeschooling online by himself. Had expressed to a friend that he wanted to commit suicide. And when she heard that, she knew immediately she had to stop her job right then.
Yeah.
I don't know how she had the courage to do it, but she said what helped her was she knew that she'd been listening to me. And she said she felt like if I could do it, she could do it.
Wow.
And that was what gave her the ability to be able to drop her big, important job and go immediately to be at the side of her son.
Yeah.
Which says a lot about her.
Yeah.
You know, I admire her more than I can say, and to think that she got courage from me. So you may hear that in the future too.
Right. Isn't that amazing? Just the ability of one person, the evidence, and bearing witness to what they've gone through and can help you. I mean,
Exactly.
It's so powerful.
It
really is. Let's talk about the future of nursing. What will that look like in a post-COVID world if we ever get to the post part of it? How will this affect nurses' overall wellness? Can we be well again? What will get us there? What are your thoughts on that?
I'm probably going to have a very different response than most of the people that you're going to be talking to. My answer is hopeful.
Yeah. Okay. That's good.
It will depend a lot on what nurses decide going forward. I truly believe that without nurses, there is no healthcare. So if we truly decide that we are the salvation of health in the United States, and we start making decisions and we stand up and demand that what we need to take excellent care of patients is heard and is followed up on, I believe that a lot of things can change. I'm very hopeful that there are hospital organizations across the country that already were doing that. And some of those people have been acknowledged by the DAISY organization with awards and various different things that they have done. That's kind of what I want to know. I don't want to put any attention or very little attention on the ones that are terrible and have abused their nurses. I want to show this is what it can look like. This is how it can be done.
And which hospital would you rather be a patient at?
Yes, exactly. It's kind of the old, when you think about mothers or families, the traditional role of the husband being to support the mother to be able to take care of the children and the family in general. That mother can't do what needs to happen, even though she is usually the central figure, unless she gets that support and encouragement from that spouse or whoever else in the picture. That has to happen in healthcare, and we're nowhere near there. We are in a disease care system, and it's all about money. It is not about health almost at all. So that has to change. And so I took 4 of my previous guests, brought them together, and I just really felt like they each had skills and abilities and knowledge that we could create something new, and we did. So we have started the Nurses Transforming Healthcare. We started in January. We are just so in the beginning stages, but we've made a lot of progress.
Love that.
So the whole thing starts based on Dr. John Silver, who was on my show, I believe in 2018 in the summer, I think like June 3rd or something like that, if anybody's trying to find it.
Okay.
And he had done his PhD, not in nursing, but, and I forget exactly what it was that the PhD was for, but he is a nurse. He's worked at the bedside. He's worked from, respiratory therapist on up. Worked in ICU, travel, just did all kinds of things. And he just felt like healthcare could be done better. And he felt like, it's kind of like follow the money. So what he did is he went around the world and he looked at all sorts of different economic systems, not just for healthcare, but for just about anything. Brought them back, laid them out kind of metaphorically on a table and said, he had 7 goals of what he felt had to happen for healthcare to become healthy. And so these economic models had to support those goals. And so what he discovered was that not one single one of the economic programs he had looked at around the world did that.
Wow.
So he said, there's got to be something. There has to be something in history that, a similar type situation. And he came up with the electric situation when electric was spreading across the country, but only to the large cities and things like that, not to the farms, not to the small towns. And so the Rural Electric Association was a brainstorm of Roosevelt, and that brought electricity to the entire country.
Wow.
Now they're even thinking it was considered a public utility. Now they're even thinking of using it for internet to spread that throughout the country more equitably.
Yep.
And so he started thinking, well, what about this? What if healthcare was a public utility? What if it was like electricity, sewer, water, all of those things that we need in life? So each person would pay in a little bit, nowhere near what we're paying now. In addition to individuals, it would also be cities, counties, states, national, regions.
Yeah.
We would also be supporting this, and everything would be based on what is working, what's the best practice across the country, and it would be at a community level. So even though there's thousands of communities across the country, it would be focused at what does this community most need. Do they need fresh food? Do they need parks and places for people to recreate? Do they need mental health facilities and assistance?
Right.
Do they need good jobs? What kind of criminal activity is going on? And so you'd have what we're calling nurse-led integrative medicine clinics who would be responsible for looking at all of those things and making sure that they were bringing in those things. And it would be funded not by insurance companies, not by mega corporations, but through public health, which has almost faded completely away from most people's understanding when it had at one point been one of the most important aspects of providing health.
I know.
But they have a structure that's already set up, and all we have to do is take that structure, build back what's been taken away over the last 30, 40 years, and start working with them. Data could go back to the hub of public health. Determinations could be made about what specific assistance is needed in different areas. Data could be shared across the country. Just imagine if in January of 2020, we had this system already set up.
Right. Yeah.
It's almost mind-blowing to realize that, the disaster that we had and the lives, almost 700,000 people lost.
Yeah. Right.
Completely, not to mention the people who will deal with this in their health for the rest of their life.
Yeah.
It's just incredible. So we're talking to, I live in Minnesota, so I decided let's look at our ground swell here and see what we can do. We're working with representatives and senators from Minnesota's government, and then also those representatives we've sent to Washington, D.C. Amy Klobuchar is one of our senators.
Oh, interesting.
And so can't get much better than that.
Yeah. That's
and
awesome.
Has been doing a tremendous job as a senator also. And also Betty McCollum is my representative, and so I've been working with her too. All of them are very interested in what we're talking about.
Give the name of the site again for nurses that want to check this out. Is it
Nurses Transforming Healthcare?
Okay. All right.
And we are just in the process right now. We do have a website up. It got what's the word? Stranded a little bit.
Okay.
One of the nurses that was doing the work for us has been ill.
Okay.
Has not been able to upgrade it. So we're hoping to be able to, we're in the process right now of getting grants, and then we will be able to hire, if you know anybody out there.
Okay.
A nurse who has, really strong website, IT, social media skills. We would definitely want to know about them. contact me at Leanne@onceanurse.com.
Okay. Yeah. No, that's very exciting and so needed. It almost makes too much sense that I feel and I am a very optimistic person by nature, but in today's climate, I worry that partisanship will just like public health has been, abused in the past year and a half plus, that it stays with its mission true at heart instead of getting sidetracked into something that it's not,
Right.
Yeah.
Well, it might just be something that could bring people together.
Yes.
That would be my hope.
Yeah.
Particularly at the grassroots. I think that the citizenship at the top level is too dysfunctional and diseased. We're going to have to put new people in there, and that's going to determine everything. Yeah. So, it's really hard to think that half of our country is completely opposite. I mean, maybe we've never been quite so divided since the Civil War, and I sure hope we don't have to fight another war.
Right.
And, begin to hear each other.
Yeah.
But I think this could be something that would bring people together because there's such opposite factions in, leave it the way it is, or, Medicare for all.
Right.
And those are great bumper stickers, but they're not so great for health.
Yes. And I think, sorry.
No, go ahead, please.
Oh, I was going to say at the beginning of our time, you were talking about how the history of nursing, we were so community driven. And I think that's where we still have our greatest influence is the people that are standing right beside us. I mean, we can yell at each other on comment threads and on Facebook all we want, but that's not going anywhere other than riling ourselves up further. So I love that you touched on that it's the community that you live in now is where you're starting. Exactly. And it has to come from the ground up. I 100% love that. And I think that it segues into the next question I wanted to ask you. For sites like NurseTech that are community driven, how they can play a part, how they can be important for nurses today that want to get involved, but maybe don't know where to put what little energy reserve they may have towards it.
I am so happy every time I find something like NurseTech. I am so completely thrilled because I think that nurses feel very isolated.
Yes.
Even within their own silo of, perhaps their own organization, of not feeling confident of who they can talk to, that it won't get back to somebody. Yes. So if people really wanted to sit down and brainstorm, how do we make this better? Mm-hmm. I can't think of anybody more than nurses who really are good at that.
Right.
Because for them, it's all about the patient, always all about the patient.
Right.
And so it's kind of like if these large organizations can get it, if we support nurses, they will take care of the patients.
Exactly. Yes.
It just has to come down to that. I just can't see any other way that we're going to be able to change it. And NurseTech would be the kind of thing where nurses can come together in a gentle way.
Yeah.
Instead of, as adversaries of, we've only got this little bit of the pot and we all need a piece of it and we're going to fight each other tooth and nail to get it.
Yeah.
It just can't work that way. Nurses have got to stand up together. We have to encourage one another. We have to be kind to each other. We just have to be what brought us to nursing.
Yeah.
And we're going to have to get it out to the public because the public still doesn't even know we don't have a good healthcare system.
Right.
That hasn't gotten through.
Yeah.
Because of, slick marketing and various different things, or you see these incredible looking buildings and you think, wow, if they can have this kind of a building, then healthcare must be really good here.
Right.
Yeah. We know that's not necessarily true and could actually be opposite of that.
Yeah. Speak a little bit about community, like communities like NurseTech and their importance for mental health, revitalizing mental health. Saving it.
That is really where it's going to come from because as we spoke before, nobody outside of nursing truly understands what nursing does. Mm-hmm. I think the doctors are getting it. I think they're starting to get it. And so it has to be that community, that connection of nurses, understanding one another and realizing, okay, where do we start? What I have not been truly very in favor of unions in the past, because I've seen them as being very aggressive, sometimes almost, cutting off their nose to spite their face kind of thing, making enemies of the administration and the corporations. Certainly we need to get them to hear us, but I'm not sure punching them in the face is how we do that.
Right.
So we have to figure out another way.
Yeah.
I have been following and actually, to some extent, supporting National Nurses Union, because they're the only people I've seen out there fighting for nurses and fighting for, getting what it is nurses need out to the public.
Yeah.
So I've kind of changed a little bit on that, but I'm still hoping to influence them to go about it in a way that can be more collaborative and really be a win-win for everybody, including the patients, especially the patients. So community is everything. Relationship, I just, my own personality, relationship is everything. If you don't have relationship, it's very difficult to get anything done in any industry. But can you think of a more important place to have relationships than healthcare?
Yeah, right. I agree. I feel like it's one of the first things we're taught as nurses is building rapport with our patients, but we need to also maintain that rapport amongst ourselves. And that leads me to my next question about sites like NurseDeck, how they can help nurses with the stress of being a nurse. Speak a little bit about that.
Right. And I think having those opportunities, one, getting it out there. So that's going to be obviously marketing, which means money, which means, for nonprofits. Actually, there's a lot of money that is coming to bear in the last year and a half for nonprofits because of COVID.
Yeah.
And it's, so I think that money is available if people know how to get it. And that's why we're employing people that can help us to get those grants. And then having that platform that you can direct people to. So either it can be a place that they can come to, or that other nurses who have found it can invite them to, or something like the Happy group, where they have learned how to be able to contact the nurses.
Yeah.
The bottom line for nurses is we are all about giving. We're not so good at taking. And we're really bad at taking care of ourselves. And asking for help.
Yes.
So that becomes one of probably our own worst enemy.
Yeah. Right.
Until we can get around to that point of recognizing that we not only have to take care of ourselves, but we have to take care of each other.
Yeah.
We can do that on a place like NurseDeck. I think that's where it has to happen.
Yeah.
The other thing that's possible is training. When I was in nursing, I ended up in many different locations. The last one was in human resources and human resource development. And so I was doing a lot of training of managers with personality, dealing with conflict. I'm trying to think of all the resiliency, all the different things that we were teaching at that time, but it never got to the level of the nurses.
Yeah.
And to me, who needed conflict management or conflict resolution more than nurses who are dealing with doctors and patients and families all at their worst possible time of their lives, usually. And so that was what I was working on when the government of Minnesota shut down because of arguments between partisans. My company lost $18 million, and I was the next person in my department to be laid off. So the last thing that they did is allowed me to do a class on conflict resolution for charge nurses.
Okay.
And I did the pilot, and then I did the first program. And everybody was like, oh, I'm going to send all my friends to this. This is so fantastic.
Yeah, I bet.
And I had to say, I'm so sorry. I don't know if it's going to be continued. I'm being laid off. And once I leave, I don't know what will happen. And it did not continue after
Well, that leads perfectly into my next question, and we've talked about this in the answers to the questions so far. But specifically, what changes do you think the healthcare system and industry needs to make to create better work environments for employees that sometimes have a hard time advocating for themselves, and, as you said, taking care of ourselves? What can the healthcare industry do to support nurses? What changes need to happen?
Huge mindset change.
Yeah.
Some of what I've already been talking about.
Hmm.
I think, this is my own personal opinion, I would love to see every single C-suite person, with whatever their other degrees are, that they have some training in nursing.
Hmm.
And nursing, because I believe that's kind of, whether that's LPN, RN, whatever the level, they cannot possibly be leading an organization where their product really is the nurse.
Yes.
Because if they want more patients, if they want better outcome, it is the nurse that's going to. The doctor can write the orders, but
I love that. Say that again.
Nobody there to carry them out.
The product needs to be the nurse.
Yes.
That is so good.
And if that was the truth, then nurses would be respected. They would be paid according to the respect that they have. They would be given healthy schedules. In fact, the nurses would be determining what the schedules are.
Right.
Nurse staffing ratios, oh my gosh, don't get me started there, but that has to be done by nurses. Who knows more than that nurse in charge on that day, on that shift, on that hour, with the nurses she has scheduled for that day and the acuity of the patients there? Who else can say what the nurse-patient ratio needs to be on that day if your outcome is you want healthy patients?
Yes.
If you don't want healthy patients, you can be a cog in a wheel and just keep throwing patients at that nurse until she drops.
Yeah. Right.
And that's where we are now. So all of that, so the structure of healthcare has to change.
Yeah.
Because we can't just change policies, or, even if we change the leadership at the top, if they are not changing the structure of healthcare and making it something where people can dialogue with each other. Doctors can talk with nurses. Doctors can talk with each other. Nurses can talk with doctors, lab, x-ray, respiratory therapy, housekeeping. They need to have input into all of the things that are going on, because they each see something different that could benefit patients.
Yeah.
And that's what we need to do.
Yeah.
And it isn't like we have to reinvent that wheel, because there have been people out crossing the country in the 90s and 2000s. Quint Studer was the company, or the man in the company that came to my organization. And oh my gosh, what a difference that made when we were developing and training relational concepts throughout, from up, down, in, out, sideways, wherever, and the patients saw the difference.
Yes, that is so true.
So it can happen. It does work. We don't have to reinvent it.
Right. I love that. Talk a little bit about society's outlook on nurses and nursing. I think at the beginning of the pandemic, we were having the rounds of applause every 7 p.m., globally. And now nurses in some ways have been vilified, or they're used as headlines to talk about vaccine mandates. How do you feel the outlook, societal outlook on nursing has changed?
Well, I think we've also said this, that people outside of nurses, and even sometimes nurses who are not working in bedside care, whether that's in a clinic, entrepreneurially, whatever, do not know what nurses do. If they ever did know, they've forgotten. I think whether it's movies, television, books, I'm not sure, but nurses still are in that handmaiden role in almost anywhere you want to look that has any nurses present. So it still comes back to not really understanding what it is that nurses do and how we advocate for patients, and just so many things. So that will be the harder one. Nurses probably need to tell their stories more.
Yeah.
to their families, to their friends.
Mm-hmm.
Maybe one of the things, again, as we talked about before, is when they're interviewing people to find out what's really happening, they have to stop going to the people who are creating the problems.
Right. Yeah.
Right. So if that's the only word that gets out is what
Right.
good job they're doing, and the nurses just don't appreciate anything.
Yeah.
Maybe it's going through patients,
Yeah.
it's kind of like if you ask a patient who just came out of a horrendous situation, yes, they're grateful to their doctor, as you mentioned, with having 2 sets of twins. But really, when it comes down to it, oftentimes it's that nurse
Oh, yeah.
that really had an impact. I've been pulled aside in a grocery store. You're my nurse. You're the one that helped me have my baby. That my baby wouldn't be alive without
Mm-hmm.
you. I came out of the voting booth one time, and someone grabbed me and said, "You're my nurse. My kids are in the car. I want you to come meet them because you helped deliver them."
Yeah.
And these kids are like, "Oh, Mom, how could you?"
That's so funny. It's funny you say that. My mom's an obstetrician, and she's still, she's retired now, but the town that she lives in now is relatively small, and all the time running into patients and families, but they always talk about their nurse. Is so-and-so still working? She was just my aunt. It's every time, hands down. That's very interesting that you said that.
Because that moral support, that spiritual support, that person who's holding your hand
and they're with you all day.
Yes.
All day long.
And they keep
and night.
back. They come back day after day. And many times, hopefully, you get the same nurse again and again. So you develop trust. And you can tell her things that I wouldn't tell anybody else, not even my family or maybe even my spouse.
Yeah.
Just so many things that nurses develop that person-to-person trust.
Right. Yeah. I love it. Well, that's all the official questions I have for you. I think we've covered so many important topics today. Is there anything else that we should talk about that didn't come up? Anything that you would like to quote unquote plug? The floor is yours.
I truly want nurses to recognize the value that we bring. I don't know how it came to be that we have listened to those people who are disrespecting us, who do not understand us and do not want to understand us. I truly feel like nurses have almost like a battered wife syndrome going on within many organizations. And clearly, those organizations are not going to be changing it if they can't see it. It's going to have to start with nurses. And I think it starts sideways, that we have got to develop that nursing warmth and trust and care and support with each other.
Yes.
And getting it out to the community. And I feel like healthcare has to change the United States dramatically.
Yeah.
I don't know how it's going to happen, but I know it has to happen. I believe that for me, it starts with these nurse-led integrative medicine clinics.
Yeah.
We're saying nurse-led because we're mainly looking at that nurse perspective of holism, not WH-ism, because that's like, okay, we're looking at all these parts and they sort of come together, but that they're integrated. Each aspect, mental, physical, emotional, spiritual, all of that has to come together to see who that person is.
Yeah.
So, and then somebody who's responsible, even if that patient has to go to somebody at a next level, maybe, the nurses and doctors and, therapists that are in that clinic can't do a surgery or something else, that it would have to go to that next level. Somebody needs to be keeping track of who were all of the specialists that we're seeing and what is the core, answer. So many times I think it ends up being something related to mental health.
Yeah.
So somebody comes in with stomach pain or Crohn's or, symptoms of Crohn's or alcohol addiction or any other kind of addiction. And when you come right down to it, what's beneath it is something that only comes out when you are safe to talk to that person. and doctors are being pushed harder and harder and harder. I just had a physical the other day, and my doctor said that everything they do now is all about capturing dollars. And so it's really not about health at all. In fact, I was given a form that said if I brought up anything new to my doctor during a physical that hadn't already been dealt with, I would be charged as a new problem patient, a new problem. I was thinking, okay, and what is the purpose of the physical?
Yeah, right. So backwards.
Completely backwards. So the doctors are doing what nurses have always done, is workarounds. How do we make it look like
right.
what they want us to do, but how do we actually take care of patients?
Yeah, right.
And that's where I think it's going to change, is that the suicides, the depression, the things that have been brought out by COVID, as bad as that is, it could be our greatest opportunity to truly change healthcare in the United States now. That's what I believe.
A pivot and a springboard.
And it's going to take all of us working together, using all of our skills to make it happen.
Yeah. I love that. I love the themes that you brought up, that our greatest allies are the ones that are alongside us, that I think we've always known that. We just need to be given the permission to speak up together. And the fact that the nursing-led integrative health, I am like jumping up and down in my seat here, because it just makes so much sense, and nurses will understand that language. You don't have to explain that concept to them. They will understand that. And I think there's enormous power there. And I, again, love the nurses are the product, especially in today's world where everybody has their personal brand, and it's all about, as you said, capturing attention and following the dollar. But if we're going to speak in that language, then yes, the product is not patient outcomes, although that's important. The product is the nurse. That will drive everything else.
The nurse will bring the patient outcomes.
Yes.
It's that line item in the budget.
Yes.
Nurses are in, we don't even have our own line item. We're actually part of room and board.
Yeah.
And as long as that is the case, anybody who sees, hierarchies and who are the people who are really important, they're never going to see that invisible nurse in that room and board budget.
Room and board. Unreal.
Any kind of important role.
Yeah. Wow. Amazing. Well, the podcast, Once a Nurse, Always a Nurse. And any other ways people can find you if they want to learn more about you and the work you've done?
You're Leanne at onceanurse.com.
Okay.
And you go to the website. We will be making it more interactive as we go forward the next couple of months. We want to be able to have people say, yes, I want to be a part of this. Here's what I can do.
Yes.
And then I'm actually hoping to be able to take charge of that, to be able to contact those people and say, great, here's what we need. Do you know anybody who can do this, or can you do this? Or
perfect.
And again, send those armies. We have 4 million nurses in the United States.
Yeah.
And think about across the world. We're probably the largest single job category across the whole world.
Right.
We could change the world.
Yeah.
We just have to believe in ourselves.
Yes. Love it. Well, nurses watching this will also be able to read through your profile that we will be doing on our online magazine, to find all those different links and to find out any more information on the topics we've discussed. Leanne, thank you so much for giving us your time. It's been awesome talking with you.
Thank you. I love talking to nurses, always and ever. It's the best thing in my day.
Awesome.
Yeah.